Colon cancer, also known as colorectal cancer, when it includes both the colon and rectum, is a significant health concern worldwide. It is one of the most common cancers, yet it is highly preventable and treatable if detected early. In today's video, All About You Tips will provide a comprehensive overview of colon cancer, focusing on its symptoms, diagnosis, treatment options, and prevention strategies. So first of all, what is colon cancer? Colon cancer originates in the colon or rectum, which are parts of the large intestine and the final stages of the digestive tract. It typically begins as small, non-cancerous clumps of cells called polyps that form on the inside of the colon. Over time, some of these polyps can become cancerous. Types of colon cancer. 1. Adenocarcinomas, the most common type, originating in the mucus-producing glandular cells lining the colon and rectum. 2. Carcinoid tumors, begin in hormone-producing cells of the intestine. 3. Gastrointestinal stromal tumors, GISTs, rare tumors that start in the interstitial cells of the colon wall. 4. Lymphomas, cancer of the immune system cells that can start in the colon. 5. Sarcomas, begin in blood vessels, muscle layers, or other connective tissues of the colon and rectum. Risk factors. Several factors can increase the risk of developing colon cancer. 1. Age, most common in people over 50. 2. Family history, a history of colon cancer or polyps in close relatives. 3. Personal history, previous colon cancer or polyps. 4. Inflammatory bowel disease, conditions like Crohn's disease or ulcerative colitis. 5. Inherited syndromes, genetic disorders like Lynch syndrome and familial adenomatous polyposis, FAP. 6. Diet, high in red and processed meats and low in fiber. 7. Lifestyle factors, obesity, sedentary lifestyle, smoking, and heavy alcohol use. 8. Type 2 diabetes, associated with increased risk. Symptoms of colon cancer. Colon cancer symptoms can vary and may not appear until the disease is advanced. Common symptoms include 1. Changes in bowel habits, diarrhea, constipation, or a change in the consistency of stool lasting more than a few days. 2. Rectal bleeding or blood in stool, bright red or very dark blood. 3. Persistent abdominal discomfort, cramps, gas, or pain. 4. A feeling that your bowel doesn't empty completely, persistent feeling of needing to have a bowel movement. 5. Weakness or fatigue caused by anemia due to blood loss. 6. Unexplained weight loss, significant weight loss without a known reason. 7. Nausea or vomiting, persistent nausea or vomiting. Diagnosis. Diagnosing colon cancer typically involves several steps. 1. Medical history and physical exam, initial assessment by a healthcare provider. 2. Colonoscopy, a procedure using a flexible tube with a camera to inspect the entire colon and rectum, allowing for biopsy and removal of polyps. 3. Sigmoidoscopy, similar to a colonoscopy but only examines the rectum and lower colon. 4. Fecal occult blood test, FOBT, tests stool samples for hidden occult blood. 5. CT colonography, also known as a virtual colonoscopy, uses CT scanning to visualize the colon. 6. Biopsy, removal of tissue samples during colonoscopy for laboratory analysis. 7. Blood tests to check for anemia and certain markers that might indicate cancer. Treatment options. Treatment for colon cancer depends on the stage of the disease, the patient's overall health, and personal preferences. Common treatments include surgery. 1. Polypectomy and local excision, removal of polyps or localized cancerous areas. 2. Partial colectomy, removal of the cancerous part of the colon and nearby lymph nodes. 3. Colostomy, creation of an opening, stoma, for waste to leave the body if reattachment of colon segments is not possible. Chemotherapy, use of drugs to destroy cancer cells, often used before surgery. Neoadjuvant, to shrink tumors, or after surgery. Adjuvant, to eliminate remaining cancer cells. Radiation therapy, high-energy rays targeted at cancer cells, often used in combination with chemotherapy, especially for rectal cancer. Targeted therapy, drugs that target specific molecules involved in cancer growth, such as EGFR inhibitors. Immunotherapy, uses the body's immune system to fight cancer, applicable in certain advanced cases. Prevention and early detection. Several strategies can help reduce the risk of colon cancer and facilitate early detection. 1. Regular screening, starting at age 45 or earlier if there is a family history, including colonoscopy, FOBT, and sigmoidoscopy. 2. Healthy diet, high in fruits, vegetables, and whole grains, and low in red and processed meats. 3. Regular exercise, maintaining a healthy weight through physical activity. 4. Limit alcohol and avoid tobacco. reducing or eliminating alcohol consumption and quitting smoking. 5. Manage chronic conditions, effective management of diabetes and inflammatory bowel disease. 6. Genetic counseling and testing for individuals with a family history of colon cancer or inherited syndromes. Colon cancer is a serious but preventable and treatable disease. Understanding the symptoms and risk factors is essential for early detection and effective treatment. By adopting a healthy lifestyle and participating in regular screenings, individuals can significantly reduce their risk of developing colon cancer. If you experience persistent digestive issues or other concerning symptoms, consult a healthcare professional for appropriate screening and guidance. If you enjoyed this video, please give it a thumbs up and share it with your friends. Don't forget to hit that subscribe button and ring the notification bell so you never miss out on our latest life tips and tricks. Thank you so much for watching.